Live from downtown Detroit, home of WDIV and Click on Detroit, Local 4 News at 6 starts now.
There are new positive signs in the fight against COVID-19, especially in Detroit. Now many are asking when the state might be ready to restart its economy.
But first, weather remains a problem with high winds battering parts of Metro Detroit. In some spots, gusts have reached into the 50-mile-per-hour range. Right now, DTE is reporting around 4,000 of its customers are without power due to those high winds.
Ben's tracking the winds that hopefully have already peaked by now. Ben.
Yeah, Kim and Karen, that's what we're thinking. The worst is probably past us, but we're not completely out of the woods yet. Could be seeing gusts between that 35 and 45 mile per hour range through the evening tonight. And right now we do have a couple spots where we're picking up more than 40 mile per hour gusts. Let's take a look at the map in Pontiac, one of those locations right now. Actually, the only spot that's over 40 miles per hour. Everybody else in the 20 and 30 mile per hour range as we speak. Nevertheless, wind advisory is in effect until 11 p.m. tonight, and that's for everybody. We will be seeing these winds subside, but it's going to be a very slow fall, so we're still going to be seeing brisk conditions until just before midnight tonight. Also, a lakeshore flood warning in effect for St. Clair County. We see these advisories and warnings a lot on the east side, but today, because of the speed of the wind, the Weather Service warning there could be significant flooding on the north shore of Lake St. Clair, specifically around Harson's Island and Anchor Bay. And that is in effect until midnight tonight, so we'll continue to watch that. We've got some cold air coming as the winds relax tonight. We'll look at that and a pretty decent weekend ahead, all in a few minutes. Kim and Karen? Oh, don't forget to download our local forecasters app. You can follow the wind speeds and the forecast for the next 10 days. It is all free in your app store by searching WDIV. Guys?
All right, thank you, Ben. Now to the latest on the coronavirus pandemic, and there are small signs the curve may be starting to flatten.
Right. The numbers, however, remain tragic. The state of Michigan reporting an additional 115 deaths today, putting the total number of lives lost at 1,602. There were 997 new cases, pushing that total above 25,000. Governor Whitmer and other state leaders are requesting a special 30-day enrollment period in the federal health care exchange so more people can get insurance.
Detroit's drive-through testing program had to be shut down for the day due to wind, but the number of people tested there is expected to surpass 10,000 by tomorrow. And the first of the federal stimulus checks began arriving today in some people's bank accounts.
Yeah, Governor Whitmer was asked today about what her benchmark will be for deciding it's time to reopen the economy.
She said it's not a matter of reaching zero new deaths, but rather a variety of factors.
We've got to see that cases are not climbing. We've got to know that we've got the resources in our hospitals to meet the needs that are there. Right now, we still have hospitals that are at or over capacity. We've got to be able to manage what we are confronting. We have to be able to detect it, so we've got to have the testing measures and the ability to trace. These are all critical components that everyone from Dr. Fauci to Governor DeWine and everyone in between has acknowledged these are fundamental to making sure that we are safe to start a phased-in re-engagement of our economy.
Well, at the city level, Mayor Duggan today applauded Detroiters for their social distancing efforts so far, but acknowledged that nursing homes really need help.
And to that end, the city is planning to dramatically increase testing at nursing homes over the next 10 days.
We're now going to be committing 240 tests a day for the next 10 days just to nursing home residents and staff. We're going to test 2,400 nursing home residents and staff in the next 10 days, and we will make sure that the nursing homes take the results of those 50-minute tests and separate the patients accordingly. We've lost another 8 of our neighbors at nursing homes since Friday, and we have got to get this nursing home issue under control.
Now, the mayor did say hospitals are reporting an easing in the number of beds they're having to dedicate to COVID-19 patients. The mayor says the biggest indicator of success will be how many of the 1,000 beds at the TCF Center are needed.
A home health care nurse at Henry Ford is talking about her decision to quit last month, saying her life and her patients were at risk. She says she expressed safety concerns about treating coronavirus patients, but was ignored. As Priya Mann reports, the nurse is sharing her story in the hopes others on the front lines will be protected.
Sabina Ashman treated cancer and transplant patients in their homes. Those patients have extremely compromised immune systems. She says when she was told to also start treating COVID-19 patients, she pushed back.
We tried to speak up, but they just kept trying to shut us up.
After a decade as a Henry Ford home health care nurse, Sabina Ashman quit last month when superiors told her she had to see COVID-19 patients.
They could see a COVID-19 patient at the beginning of the day and then cross-contaminate 5 other regular healthy people.
She says her concerns were not taken seriously.
Home care did not have the right precautions before they made the decision to start taking COVID-19 patients. Again, you have to have the proper isolation kits. You have to make sure they're not listed on the same day as your current patients.
Ashman filed a complaint with MIOSHA. However, the industrial hygienist specialist was satisfied with Henry Ford's response.
I wish that they would physically go down there and, look at the paperwork. For 2 weeks, there was a good contamination going on, and that saddens me.
In the midst of a pandemic, the mom of 2 doesn't know what she's going to do next.
Not sure if I want to be in nursing anymore. Wouldn't mind running my own home care agency, one that's honest, one that's really going to look out for patients.
Ashman says she's scared for home care and hospital nurses on the front lines.
Definitely my life was at risk, along with my coworkers. I don't feel that they're doing enough still, but it's up to my coworkers now to fight that battle.
Now, Henry Ford says every home health care nurse has the personal protective equipment they need. In a statement, the hospital says to further reduce the risk of exposure, our team members are directed to schedule visits with COVID-19 patients and non-COVID-19 patients on separate days. When that is not possible, visits with COVID-19 patients are scheduled at the end of the day. Of the nearly 2,000 patients we're caring for in their homes, 46 are recovering from the coronavirus. We have the full statement up on clickondetroit.com. Reporting from Midtown, I'm Priya Mann, Local 4.
President Trump and his coronavirus task force are holding their daily briefing right now, streaming on clickondetroit.com. Dr. Anthony Fauci says more needs to be done in order to close the gap in infections within the African American community.
I made it very clear to them that what we have to do is focus on getting the resources where the vulnerable are, to be able to get testing done, to be able to get the appropriate identification where proper and where appropriate, to isolate and contact trace if we can, but also to help mitigate in a community that is suffering, and suffering much more disproportionately.
Much more from the task force and the full national perspective ahead at 6:30 on NBC Nightly News with Lester Holt. It's one of the biggest questions in this pandemic battle. Once you recover from the illness, are you immune to catching it again?
But the answer to that question may be even more complicated than previously thought. Our Dr. Frank McGeorge is here to explain why. Doc?
Officials in South Korea have reported around 100 patients thought to have recovered from COVID-19 have tested positive for the virus again. The World Health Organization says it is investigating those reports. So what's going on? Well, there are a few possibilities to consider. With many viruses, once we're exposed to them and successfully fight them off, our body develops antibodies that protect us from the illness. How long that immunity lasts varies from virus to virus. Now, experts think people who recover from being infected with the SARS-CoV-2 virus should have some degree of immunity. But the virus is so new, we simply don't know for sure how much and how long it lasts. South Korea's CDC suggested that the virus may have been reactivated in recovered patients who later tested positive. Experts say another possibility is that the test is detecting lingering pieces of the virus's genetic material, not a true reactivation, or perhaps their second negative test was a false negative. Now, another theory, some of the patients were reinfected. More study of these patients is needed to determine the truth, but it could have huge implications for nations relying on antibody tests to determine who is safe to return to work. It could also impact the development of a vaccine. A successful vaccine would need to generate an immune response that's strong enough and lasts long enough to offer meaningful protection. Different targets could generate different levels of response, but determining that will also take time. Now, there is some research underway in China that may help answer some of these questions. This is a key issue in how we're going to be able to fight this virus in the future and how long it could continue to be a threat. Back to you.
All right, Doc. More than 1 million Michiganders, more than a quarter of the state's workforce, have filed for unemployment. And the state's website and call center have been unable to keep up with the demand. The website crashed this morning just as even more Michiganders became eligible to file. Many are asking, now what? Earlier today, state leaders addressed these ongoing issues. Here's our consumer investigative reporter, Hank Winchester.
The state was all set to hold a press conference this morning, talking about the unemployment agency, the website, the issue with the phone line, and now the other Michiganders who were eligible to file. Well, those plans were all thrown out the window once the website crashed yet again.
We've greatly expanded the number of staff and the resources we have dedicated as servers and other resources to make sure we can take these claims. However, every state, including Michigan, has struggled to cope with these surges.
Today, the director of Michigan's Department of Labor and Economic Growth with the governor for her media briefing. The plan was a separate presser that was set for this morning, but that was scrapped shortly after the state's unemployment website crashed yet again.
We understand that this is frustrating, and we want to help. The governor, Director Steve Gray of the Unemployment Insurance Agency, and the dedicated staff of LEO and UIA are working around the clock to make sure that you can file your claim, and we won't rest until everyone has done so.
The system cannot keep up with demand, and that demand only increasing now. Why? Today, those who are independent contractors, self-employed, or low-wage workers can also file for benefits. However, good luck with a website that can't keep up and a phone line that is regularly busy. Those who've been working to connect have had little luck.
So I get a message from Verizon saying this number is not taking any calls, or I get into the voice response unit in the department, but then it disconnects. It says, oh, press this number and press this number. Sorry, we have too many people calling. Click.
Again, we are hearing another press conference is scheduled tomorrow to get answers regarding the unemployment website and the plan moving forward. We'll, of course, be listening in. We'll have more information for you right here on Local 4. I'm Hank Winchester. Help me, Hank.
And for the latest information on filing for unemployment in Michigan, head to the Help Me Hank page of clickondetroit.com. There you will find an updated list of resources that can help you through the process.
Yeah, okay. Well, ahead here at 6, a local family struck twice by coronavirus.
First, she lost her son, and now she's told she can lose her husband as a result of COVID-19. Hear from her in just a few.
Homeschool's not just for kids.
You got a unique skill? Teach us how to do it.
Go to the Morning Show page at Click on Detroit, and your video could end up on Local 4 News Today.